After inhalation, tuberculosis cells are going to travel to the lungs of the newly infected host. Macrophages in the lungs will attempt to perform their job, which is to phagocytose the bacterial cells and break them down by the use of lysosomes and degrading chemicals or enzymes. Though allowing themselves to be consumed, breakdown of the TB cells is prevented by the bacteria's mycolic acids interfering with lysosome function. Instead of being chemically broken down, the bacterial cells reproduce within the macrophage. This triggers an inflammatory response, which draws even more macrophages to the site. The process of engulfment and replication continues. In an attempt to contain the infection, macrophages mass together and form multinucleated cells. Some macrophages accrue oil droplets. This is believed to actually assist the tuberculosis cell's survival. Other lymphocytes are also brought to the area of the infection and surround the macrophages and bacterial cells in an attempt to perform an infection containment. This mass of cells are known as tubercules. Eventually, a fibrous layer surrounds the tubercle and may even calcify. The bacteria survive this process, but low pH and limited oxygen prevent them from further growth. The TB bacterial cells are now in a latent phase and may remain so for an extended period of time. At this point in time, the patient will be asymptomatic. Treatment during this period is difficult. Though being retained in a state of limbo within the tubercle, it is also protecting the bacterial cells. Fibrous tissue, calcification, and cell masses will prevent antibiotic medication from reaching the TB cells. If tuberculosis are detected in a patient, monitoring will be necessary. If the immune system is not successful in eradicating the infection, or TB cells are triggered out of latency by environmental change, treatment should be administered immediately and to completion. A question is posed whether it is ethical to jail a person who has been diagnosed with a highly drug-resistant strain of TB, but refuses to follow treatment protocol and intends on still being in public or traveling. This actually isn't an ethical question, but a matter of necessary obligation and performance of due diligence to the public. Jailing isn't a viable option because other prisoners and jail staff are at risk of infection. If anything, this is the ethical question. Anyway, forced restriction and quarantine would be necessary until the threat of infectious spread has been negated. Personally, I don't give a crap if someone wants to get a Chipotle burrito or catch the next Hamlet performance. That doesn't entitle them to spread an infectious disease of lung-eating bugs to everyone else. And if your selfishness puts the lives and health of countless others at risk for the extent of the foreseeable future, your wants are not relevant anyway.